Welcome back to our Busting Addiction and Its Myths podcast. I'm Bruno J., and I have updated the introduction to our episodes in order to address an issue that we cannot ignore, nor do we want to. It looks like COVID-19, the coronavirus, will be with us for some time. Some say for another year or two. People are as frightened as they ever have been. They seek safety for their families above all, protection from the virus and from economic insecurity. But many families also face an added burden, drug addiction and alcoholism in their own homes, and what to do about it. There's something you should know. We, SafeHouse Rehab Thailand, were founded on the idea of safety. We hold on to the truth that clients deserve to come to a treatment clinic where they can at least feel safe and sound. Devoting ourselves to safety first gives us the firm foundation upon which everything else is constructed, hence our name, SafeHouse Rehab Thailand. Thailand has been recognized as one of the world's safest places to be during the pandemic. Further, we at SafeHouse have made the right adjustments so that clients and staff remain and feel safe and sound. Masks are mandatory, as is social distancing, mandatory hand cleaning, daily blood oximeter readings, which is an early warning measure, and if by chance anyone doesn't feel well, the local hospital in Bang Bung is only minutes away. My podcast, Busting Addiction and Its Myths, is dedicated to serving families of still suffering addicts and alcoholics by providing evidence-based advice and insight so that you can make a better informed decision on what to do and what not to do. We are sponsored by SafeHouse Rehab Thailand, dedicated to a modern approach to recovery, which means that we absolutely outperform traditional rehabs when it comes to diagnostics, technology, and aftercare. To learn how we can help, just visit safehouserehab.com, where we post the latest news. Hi, this is Bruno J., and welcome to episode 5 of season 5 of my podcast, Busting Addiction and Its Myths. This podcast is sponsored by SafeHouse Rehab Thailand, a premier drug and alcohol rehab dedicated to enhancing the art and science of recovery. We represent the modern approach to recovery, founded on safety, which is why we absolutely outperform traditional rehabs when it comes to the 4 major factors that can make all the difference between a one and done and a lifetime of clean and sober living. Something to think about as you check out Thailand rehab reviews. First, SafeHouse is integrated into a lively modern Thai community with all the features of real life, which better prepares clients to re-enter their world back home. 2, we've developed a more sophisticated intake and detox process to address the trend that is sweeping through addicts' lives today, addiction to multiple and newly emerging substances. 3, we're incorporating new technologies that have been proven to improve and speed the rate of recovery. By that I mean simple or complex technologies that have already shown promise in the field of recovery. And 4, if the end goal is long-term sobriety, then an effective aftercare program which contains the tools essential to success is actually the most important aspect of treatment. Our We Care program will follow clients wherever they go to ensure that they own their own recovery, to help them launch and sustain the right trajectory over the long haul. Today I want to talk about the research you should do before you commit to coming or having your loved one come into a treatment program in Thailand. We'll focus today on the Thailand rehab reviews that will hopefully guide your decision-making process. We say here at SafeHouse that the first thing we want for you is to have you make an informed decision about the best treatment course to take at this critical time. There are several treatment facilities vying for your attention in Thailand, many Thailand rehab reviews, and we thought it makes sense to consolidate all the advice in one place right here. By the way, a blog version of this podcast is to be found at www.safehouserehab.com. You may not choose us every time, but we are confident that when you look at all the factors that should go into your decision, SafeHouse Rehab Thailand will stack up very well. Let's start with our common goals as a category of rehabs in Thailand, to give clients the best possible chance of turning their lives around and begin the journey to a lifetime of clean and sober, joyful and productive living. You can also use the advice to evaluate any rehab that you might be considering anywhere in the world, for that matter, since basic best practice truths apply everywhere. So based on our research, here are the things to watch for and evaluate as you go about the business of making a choice that will make a difference to your loved one over the long haul. These choices will undoubtedly have long-term consequences for yourself and for your loved ones. These points are in general order of importance. 1. Evidence-based treatment is the foundation. Best practice treatment revolves around behavioral therapy designed to help clients lower their stress levels, redirect harmful thoughts, and help clients deal with a variety of complex emotions. A typical label for this best practice approach is CBT, which stands for Cognitive Behavioral Therapy, and ACT, which is Acceptance, Action, and Commitment Therapy. This introduces clients to a new way of thinking and behaving. These best practices serve as the foundation of our program at SafeHouse, but we are also committed to a more advanced approach to recovery, which we outlined earlier. Make sure that a rehab abides by proven processes that stand up to a rigorous inspection. Watch for therapies and or medications that are supposed to work, quote, miracles, which is just a way of extorting hard-earned money from people desperate for just such a thing. We should quickly point out that no rehab on our Thailand rehab reviews list would ever approach anything like that, but you would be surprised at how many people have already fallen for false cures when there is no cure. 2. Employing a fully qualified staff makes a critical difference. The quality of staff can vary greatly, but most rehabs in Thailand do very well on that score because the staff is typically trained in the UK, Canada, Australia, or the US, all of which uphold the highest professional standards of training in the world. Our professionals then come to Thailand fully prepared to help clients recover here. We insist not only on a bachelor's or better degree in addictions counseling from senior staff, we also require that a professional have at least 5 years' experience as a staff member at a treatment facility or in private practice as an AODA, alcohol or drug addictions counselor. The one thing you will immediately notice, regardless of experience level or type of training, is that professionals in our field demonstrate a genuine calling for this type of work. And because many of them are in fact recovering addicts or alcoholics themselves, they bring special insight and empathy that no other type of training can possibly instill. That said, all our professionals, recovering or, quote, normal, are themselves exceptional people in their own right. 3. Accreditation and licensure safeguard your investment. The rules for licensure in Thailand were changed and upgraded recently, which means that all rehabs had to resubmit their credentials to the Thai Ministry of Health, including that of SafeHouse. Our reapplication is in the final stages of approval as of this writing. Further, we have a contractual relationship with a regional private hospital and an addictions physician, along with 2 nurses experienced in addictions treatment. This is important to know since detox needs to take place in a hospital setting under the supervision of a prescribing physician. Next to the qualification of the staff, the topic of licensure comes up frequently among Thailand treatment reviews. 4. Dual diagnosis treatment could make the difference between success and failure. We strongly recommend choosing a rehab that is able to treat co-occurring disorders, especially bipolar disorder, and not uncommon condition. Addictions are often symptoms of a deeper issue rooted in trauma, abuse, or mental illness. Key to treating dual diagnosis clients is precise diagnoses on the front end, followed by professional care customized to that client. Our counselors are trained in identifying and validating co-occurring disorders and in treating both the disorder and the addiction. Addiction and mental disorders interact with one another, but neither is necessarily the cause of the other. 5. Aftercare is essential to long-term sobriety. The residential treatment program lasts for 30 to 60 to 90 days, often followed by a longer stay in a sober living environment. Therefore, the intensive inpatient treatment, which lasts only for a short period, is but a start on the path toward the end goal, recovery for life, lived one day at a time. Aftercare support cannot and should never be underestimated. Staying clean in a highly structured environment within the rehab is one thing, but what about the stresses and triggers of living in modern society? In recognition of this challenge, we developed a full set of aftercare tools which we call the We Care program. The kit of tools includes a customized follow-up contact schedule via Skype, Zoom, WhatsApp, etc., a list of local Alcoholics Anonymous or Narcotics Anonymous meetings, and reading material to help our clients re-enter real-world society. 6. A supportive family is the safety net. The sad reality is that the family's well-being is eroded by the presence and progress of addiction as it rips through the home. Without realizing it, the family has been drawn into a high-intensity, codependent relationship with their loved one. Therefore, the family needs to be educated on the nature of the disease, the effect that it's had on the family dynamic, and what type of non-enabling support is necessary to help the addict truly recover. At SafeHouse, we maintain an ongoing conversation with family members, who are paying the way most of the time anyway, and we also conduct pre-discharge counseling sessions for the family, including the addict or alcoholic. We guide the family in unleashing the power of we, which has been found to be of immense value in supporting the recovery of addicts and alcoholics, as the experience of Alcoholics Anonymous has so vividly demonstrated. This is yet another topic that comes up when family members search Thailand treatment reviews. 7. Success is more than completion of treatment. A common success metric is how many clients made it through treatment without dropping out. Of course, this is a woefully inadequate way to measure success. At SafeHouse, we keep and update records of our clients' progress through life, and we're always delighted to hear from them, often years later. Anyone who tells you that they achieve an X% success rate needs to be asked over what time frame. If an addict relapses 10 years later, does that mean our treatment has been a failure? Or is it that the addict became complacent about working his program? It's unrealistic to push the responsibility for long-term sobriety to the rehab when we advise clients, own your own recovery, be responsible for caring for yourself, for you have access to all the resources necessary for a lifetime of clean and sober living. So what have we learned as we scanned the landscape of Thailand treatment reviews? 1. Watch for best practice, evidence-based treatment processes, and by all means do not fall prey to miracle cures when we all know there is no cure. There is treatment, however. 2. A truly professional treatment program will be licensed by the Thai Ministry of Health and will employ a staff specifically trained in addictions counseling, as we have here at SafeHouse. 3. Because many addicts and alcoholics are dually addicted, the staff needs to be able to identify, validate, and treat both sides of the equation. The source of addiction might arise from trauma, abuse, or mental illness to begin with. 4. Aftercare is critical to long-term success. This fact also touches on the success rate, which quite honestly is dependent on how dedicated to self-care the client is after leaving treatment. At SafeHouse, we work extra hard at giving clients the best possible chance at long-term sobriety with our We Care program. The bottom line, said another way, is to reduce the odds of a relapse, the fear that all members of the family carry with them. 5. The family dynamic has been warped by the presence of addiction in the house. The family needs to be educated on the nature of the disease and how they can best help their loved one recover and not enable him further, which can then lead to a relapse. Thank you for tuning in today. This podcast is sponsored by SafehouseRehab.com. SafeHouse Rehab represents the modern approach to recovery founded on safety as our first priority. We absolutely outperform traditional rehabs with a sophisticated intake protocol, application of new techniques, and a more robust aftercare program.